Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome to Antiviral Agents 1 Part 3 video. In this video, I will cover the topic of anti-influenza agents. I hope all of you have read my lecture notes. Influenza virus infection is a highly contagious airborne disease that causes acute febrile respiratory illness and results in a variable degrees of systemic symptoms ranging from mild fatigue to respiratory failure and death. Influenza virus strains are classified according to their core protein, species of origins, and geographical site of origin. Both strains, A and B, are transmitted mainly by respiratory droplets from coughing and contact with an infected person. Influenza A can be carried and spread to human and animal, while strains of influenza B are exclusively infecting humans. Influenza C virus is usually only associated with minor symptoms. Structurally, the influenza virus is spherical in shape. It is covered in an envelope made of lipid bilayer with spikes of glycoproteins called heme agglutinin and neuraminidase. These proteins enable the virus to effectively bind with a host cell. Within the interior of the virions are the viral RNAs. There are 8 of them for influenza A viruses. These are the drugs that we use to treat influenza virus infections, mainly for influenza A and B. The first group is the inhibitor of viral uncoating, amantadine and rimantadine. This group of drugs is effective against influenza A only. The second group is the neuraminidase inhibitors, zanamivir and oseltamivir. These neuraminidase inhibitors are effective against both influenza A and B. First, we look at the inhibitor of viral uncoating, amantadine and rimantadine. The main action of these drugs is they block the M2 protein channel of the virus particle and inhibit uncoating of the viral RNA within infected host cell, thus preventing its replication. Influenza B does not have an M2 protein. This is the reason why amantadine and rimantadine only effective against influenza A but not against influenza B virus. The common adverse effect of this group of drugs include gastrointestinal symptoms such as nausea, anorexia, and CNS symptoms such as nervousness, difficulty in concentrating, insomnia, and lightheadedness. Please bear in mind that amantadine has the ability to cross the blood-brain barrier, thus may cause neurological symptoms as mentioned before. However, rimantadine is not efficiently crosses blood-brain barrier, thus it has fewer CNS reactions. Next group of drug is the neuraminidase inhibitor, such as oseltamivir and zanamivir. The neuraminidase enzyme is usually found on the surface of influenza viruses that enables the virus to be released from the host cell. These neuraminidase inhibitors will interfere with the release of progeny influenza virus from infected cell to a new host cell, halting the spread of the infection within the respiratory tract. This neuraminidase inhibitor group of drugs is effective against both influenza A and influenza B, and they should be administered early because the replication of influenza virus peaks at 24 to 72 hours after the onset of illness. Oseltamivir is an orally active prodrug in which it needs to be hydrolyzed to its active form by the liver before it can exert its actions. Meanwhile, zanamivir is not orally active, thus it needs to be inhaled or administered intranasally. Both drugs are eliminated unchanged in the urine. This drug can be given as treatment or prophylaxis. The side effects are as stated in the slides. It includes GI discomfort, anaphylactic skin reaction, and CNS symptoms. That's all for now. See you in Antiviral 2 lecture series video on antiretroviral drugs. Until we meet again, Assalamualaikum. Bye-bye.